But what I'm also reading is that this will not be a trauma hospital. And if it is not a trauma hospital, I do not think it would actually solve the crisis.
For thousands of people living in the metro area, a medical emergency means a race between time and traffic. But now a $900 million proposal could mean a new hospital in South Fulton, bringing access to health care and a measure of relief.
So they're calling that a healthcare desert. I'm struggling with that term for that area, South Fulton. There was a hospital about, I don't know, maybe 10 miles maybe from there that closed down a few years back. And that hospital, I think it was a Wellstar, don't quote me on that, but it was on Boulevard and it closed. And so what it caused was a lot of people who went to that hospital to go to hospitals in the suburbs. So that'd be Piedmont Fed, Piedmont Henry, Piedmont Noonan sometimes. And now what you have is people are saying, well, this is going to solve our crisis. But what I'm also reading is that this will not be a trauma hospital. And if it is not a trauma hospital, I do not think it would actually solve the crisis. Now, do I think that we should build as many hospitals as possible all the time? Let's debate it. Right? I can see why some would say yes. I can see why some would say $1 billion could probably help if we just give people insurance. So you kind of got like that argument that I hear a lot. But I do think for cases of diversion, which is what essentially we have a hospital that someone goes to the hospital and the hospital's like, I don't have any beds for this person. If they can open up X amount of beds, then I think that there's a clear path to why that's needed. But on the backside of that, I don't know if this is the right time to be open. Hospital, right? You got government cutting hospital funding left and right? It's going to continue to happen. They're going to cut more funding next year than they did this year. That's my personal belief. Number two, people losing insurance left and right? So if you're talking about why hospitals go out of business, and I've been pretty open about saying EMTALA is a huge reason why hospitals go out of business. You're moving to another area where you're going to try to capture that Kemp Creek area. A lot of those people who have most people have insurance, but those people originally weren't going to Grady anyway. Right. So they're not going to say, now I'm going to go to the Grady in my neighborhood. What I think is going to happen, one of two things, because something has happened. One, either people are going to lose access to their insurance at a higher rate than what we expect, which is what I think personally is going to happen. I think I've been saying this for a while, and it has been true. And every time I look up, more people have lost access to insurance. But when that happens, the people who could have gone to the doctor are not going to urgent care, and those people who are not going to urgent care are going to the hospital. So is it going to relieve some pressure off of the Grady emergency room, the Piedmont Fed emergency room, the Piedmont Noonan emergency room, the Emory? Yes, it will relieve some pressure from the emergency rooms. However, a lot of that pressure is going to be for people who don't have insurance. Just because you move 5-7 miles on the block, I don't think that those people are going to have more insurance than anything. I genuinely believe that less and less people are going to have insurance, and they're going to be going directly to the emergency rooms for the common cold. And I think that's going to be a problem long term. So I hate to say this, but I don't know if that's the best use of capital right now. I'm not saying it's a bad thing, but I think if it were me, if I were trying to alleviate something, I would go to areas like rural communities and build something small there, get you a footprint there. And I know people are going to say, that doesn't make business sense. But if we're in healthcare for business sense, a lot of stuff that we do, that's just a fact, right? So I think for us, when I look at it, I say, well, let's alleviate some pressure from the hospitals. Yes, but who takes the gut punch for this? Grady. So kudos to them for going out and doing something that other hospitals should have done originally. But I think at this time, they're going to take a huge gut punch, and I don't know how that's going to end.